With all of the talk of blood clots in the news lately, it's very important to understand what the signs and symptoms of developing a blood clot actually are. I'm Dr. Ken Berry, a family physician, and this video is going to tell you the 7 warning signs of a blood clot. By far the most common blood clots that you're likely to have are a blood clot in an extremity, a leg or an arm, or a blood clot in your lungs. First, let's talk about what puts you at increased risk of forming a blood clot somewhere that it shouldn't be. Now, forming a blood clot when you cut yourself, that's an excellent mechanism to help you heal, and that's a good thing. But forming a blood clot inappropriately inside of a blood vessel is very, very bad, and that's why you need to know what puts you at increased risk. So here are the risk factors that increase your risk of having a blood clot. If you're on any kind of synthetic artificial hormone, this can be for birth control, this can be for period control, this can be for menopause, that's going to increase your risk of having a blood clot. If you are overweight or obese or morbidly obese, that increases your risk of forming a blood clot. If your triglycerides are high, you're at increased risk of a blood clot. If you are a smoker, and it looks like this is cigarettes, cigars, pipes, any kind of tobacco smoke increases your risk of a blood clot. The research is still out on whether smoking weed increases your risk or not. If you're pregnant, you're at increased risk of forming an inappropriate blood clot. If you have diabetes, you are at greatly increased risk of forming a blood clot. If you're over the age of 60, your risk goes up a little bit. If you've been inactive for a long time, and this can be just sedentary around the house, or you sat in a bus or plane for a 12-hour trip, any of those can increase your risk of a blood clot. If you've had any kind of surgery in the last few weeks, especially orthopedic surgery on a bone, if you've had a broken bone, all of these things increase your risk of forming a blood clot. If you have certain blood disorders like factor V Leiden, then this increases your risk of a blood clot, but your doctor should have already discussed that with you. You may notice a recurring theme here. Anything that causes you to have obesity, like metabolic syndrome, diabetes, high triglycerides, any of these things increase your risk of a blood clot, and that's why it's so important to try to stay healthy, keep a normal weight, and keep a normal blood sugar. Also, having any form of an autoimmune condition or any cancer is going to increase your risk of having a blood clot. Now, first, we're going to go over signs and symptoms of a blood clot in your leg or in your arm. Now, it's much, much more common to have a blood clot in your leg than in your arm, but it is possible to have a blood clot in your arm. So if you have these signs and symptoms, you need to see your doctor. The first sign is redness around a specific area. This could be on your calf or your thigh or your arm. Redness is not caused by an injury. Second is when you touch the skin of the area, it feels warmer than the skin on the other extremity, arm or leg. If you have pain at that very specific area and you haven't had an injury, that is a sign that there's a blood clot underneath that skin. If you have a cramp-like feeling underneath that area, almost like a Charlie horse, it's kind of a weird crampy pain, but not really a cramp, that can be a sign of a blood clot. I've got a great video about muscle cramps. I'll put a link up here at the end if you want to learn more about leg cramps. Now let me give you the signs of a blood clot in your lungs called a pulmonary embolism. This is less common than a blood clot in the leg, but it's much, much more dangerous. It can actually be life-ending. So the signs of a blood clot in your lungs are unexplained sudden shortness of breath. So you're not doing anything and all of a sudden you become just out of the blue, short of breath. That's a huge red flag that you might have a blood clot in your lungs. The second is a new onset unexplained cough. The next is just your heart rate starts going faster than it normally does. So whatever your resting rate is, now you're resting and your heart rate is much faster for no real reason. If you have just a weird chest pain, I've got a video on this channel about all the causes of chest pain, and a blood clot in the lungs is definitely one of those. Or if you just start new onset feeling fatigued or just don't feel like yourself, or you have this sudden impending feeling that you're about to die. Any of these can be a sign of a blood clot in your lungs. Blood clots in the legs or the arms are not inherently dangerous, but the reason we care about them is that if part of that clot breaks off and gets to your lungs, then that becomes that life-threatening event. So if you have 2 or more of any of these symptoms and you're just a regular healthy human, you need to contact your doctor immediately for further testing. If you have any of the risk factors I talked about at the beginning of this video, and you have even one of these signs, it might be prudent to reach out to your doctor and see if further testing is warranted. If you know someone who might enjoy this video, please consider sharing it with them, or you can share it on your social media. You're always welcome to do that. This is Dr. Berry. I'll see you next time.